Good morning! Happy Monday! Just kidding. You are gonna have to drag my ass to work because I'm just really not feeling it. Why? Okay, I promise you it's not all negative. I know it sounds like I'm just speaking about everything that's bad about my job, but I mean, you don't want to hear everything that's bad. You want to hear the good stuff, okay? So I promise something is coming to tell you about the positive parts of dentistry. Of course, like why else would I be here if there wasn't some good things? But today, let's be real and honest and talk to you about why dentistry sucks sometimes. And if you are new here, I am Dr. Wendy. I am a dentist here in Denver, Colorado, and I talk about things like oral health, how to get into dental school, and the truths and realities about being a dentist. So let's talk about number one. There are definitely challenges to having patience. I thought I wanted to work in a field that helped people, always interacted with people, build rapport, but sometimes it can be very exhausting. Whether it's difficult people, impatient people, people that are just mean, but not just that. Sometimes there are very nice people and they just have very difficult or impossible mouths to work in. Because let me tell you, the amount of patients that have gag reflexes or strong tongues or very tiny mouths and can't open or jaw problems really hinders your ability to do your job. If I could just work on mannequins like in dental school for the rest of my life, that would be amazing. Sometimes a patient's tongues just are everywhere and you tell them to relax their tongue and it just gets worse. It really slows you down, and I have had a scary incident where one of my patients' bottom of the tongue just kind of nicked the burr when I was working, and it was just Niagara Falls bleeding profusely, and it's scary. You have to like take a lot of time to manage that situation. Patients that can't lean back, let me tell you, there's so many patients with back problems who cannot lean back or are in a wheelchair, so you have to either stand or lean over and otherwise just be breaking your back just trying to get your work done. Number two, and this is the most important reality to understand, is that everything you do can and will fail. Take that in for a moment because it's a very hard thing to understand and accept, especially for a young dentist when you're eager to get things started, you want to be the best dentist you can, but somewhere along the road, your work, no matter how good it is, will fail unless we have perfect conditions. Now, in rare circumstances, the patient will live their life and die with your work still intact, but that's if you did your job perfectly, the patient takes really good care of their teeth. But in a lot of circumstances, the patient just doesn't take ideal care of their teeth, and it will either break because they grind or they don't floss and it'll decay again. Just be expecting some work to come back in their hand saying, "You did this to me." No, I'm kidding. A lot of patients are pretty understanding when work fails, especially if it's, 4 or 5 years down the road. The next aspect that really sucks also is managing scheduling, especially if you have flaky ass patients. You know, the ones that will come in 15 minutes late, doesn't matter, they don't respect your time, or just no call, no show. And maybe they were a big case for the day and you blocked out 3-4 hours in your schedule for them. And if they don't show, or if they cancel right before they were supposed to show up, you're just doing a lot of nothing that day, and that directly affects how you're going to pay your bills, how you're going to pay back your loans, and it's very stressful when that happens. And the last thing I'm going to talk about is a little bit hard to explain, but a lot of students want to go into dental school because their goal is to make a difference in someone's life or make the patient feel confident again in their smile. Like, how many times have you heard that? I'm sure it's in maybe 95% of personal essays or during the interviews. I want to make a difference. But the truth is, almost all of my patients day to day, for the most part, are back teeth because those are the ones that get affected the most. I would say almost 90% of the time you are working on molars, and most patients just don't really care about how the work looks. They just really care about how you get them in and out. Of course, we do anterior cases. I mean, they're not that uncommon, but they will remember you if you fuck up, essentially. A lot of the patients just don't want to be there. A lot of patients just fear the dentist, hate the dentist, had to take off work to come to the dentist. As long as you can minimize pain, minimize the time they have to be there, they'll be pretty happy with that. But if they hate it, they'll definitely let you know. Another thing I sometimes worry about is the fear of getting sued. It might not be a common thing in your country, but I know in the United States, you are required to have malpractice insurance. And depending on the procedures you do, you might have to cover your ass more than others. So for risky procedures like implants or surgeries, you have to be really careful. Even in basic situations like doing crowns or fillings, like if a patient is unhappy with you and they're kind of an asshole, they're gonna come after you and they will come sue you or kick you off the board. And it's happened. It happened to my boyfriend just last year. Even though he's a really great dentist, he really cares about his work and his patients. Sometimes patients don't understand your intentions. Some patients just don't get it. They're just kind of rude and only really think for themselves, and they'll come after you if they want to. All right, guys, so that is 5 things you might not have known about why dentistry kind of sucks sometimes. And like I said, I will go over some positive things. If you'd like, let me know. Or if you have any comments about what you're waiting to expect from dentistry or what you have heard, good or bad, let me know. So I'd really like to know if this changes your perspective on becoming a dental student, or if you already are a dental student, does this change how you feel about graduating and becoming a dentist like me? Let's talk again soon, and hope you have a great day. Bye!